Today we continue our lecture on interpersonal communications. Therapeutic communication skills. Therapeutic communication improves patient relationships. We need to be silent and allow the patient to think about what's being said without pressuring them to answer. We need to be accepting. You can give a slight nod or a yes. Give recognition. Show the patient you see them. Offer yourself as available to meet their needs. Please feel free to call and leave a message, and we'll get back to you as soon as we can. And allow the patient to begin the communication. So how are you today? Listen to them, look at them, eye contact, and hear what they are saying. And offer general leads such as, go on, please continue. Make observations of problems you notice, such as a person who's coming in saying their arm hurts. If they're continuing holding their arm and telling you that they, fell against a chair, then this is an observation that you need to report. And therapeutic communication improves patient relationships even more so by encouraging communications by saying, can you tell me how that happened? How are you feeling now? Now, we mirror what they say by restating what the patient said. And you will learn that when you are rooming a patient and they're telling you their chief complaint, to write their words down exactly. This is a legal document, and we need to put down the patient's words exactly on what they said. And then we can give that back. Reflect. Ask the patient their opinion. Do you think you'll be able to, take care of yourself, or do you need some help? Focus to help the patient stay on topic. And again, this is where you might kind of bring them back into the conversation. So you were telling me about is a good way to do that. Allow the patient to express themselves deeply. If they need to tell you some terrible things or some sad things, please let them do that. And ask the patient to provide clarifying information if you're not sure on what they're saying. And summarize what they're saying. Gather and organize important points of the discussion and say, so you're telling me that your elbow hurts because you were walking and you fell against the wall. Okay, thank you so much. Now, what is ineffective therapeutic communication, known as roadblocks? Reassurance can give false hope. Do not tell the patient they're going to be okay, no matter what. Don't ever tell the patient everything's going to be all right. And licensed practitioners are also told, you never tell your patient everything's going to be all right. You can tell them the doctor will be in to see you and we'll see what we can do for you. How about giving approval? Seek progress instead of praise from your patients. So this is how these are going. That's good. Disapproving. Again, do not pass judgment. And some patients may be angry or upset. So don't argue with them. Okay? Agreeing, disagreeing, don't argue with them. Give them the information. I've got it, and I'll give this to the practitioner. Advising, it's outside of your scope of practice, so you do not ever give advice or information to the patient. Probing can push beyond patient boundaries in the sense that you don't need to know that information. So let the practitioner ask for the details. And defending your own opinion shuts down patient communication. So don't be offensive in defending your opinion. Requesting an explanation may be intimidating, so we again have to learn how to say, could you please tell me more? And minimizing feelings is judgmental. We're not doing that. And we're not stereotyping our comments. They're very impersonal as well. Gives you a lot to think about. What are defense mechanisms? We have these 6 defense mechanisms, which you'll need to learn with examples. Compensation, overemphasis of a trait. Denial, you reject unacceptable factors, and these are defense mechanisms of the patient. Displacement, where the patient transfers the blame to someone else. Or dissociation, denying emotional significance. Identification is mimicking the behavior of another. And introjection is adopting others' unacceptable ideas instead of stating your own. These are defense mechanisms that the patient may show to you. Please be aware of them. Communicating in special circumstances. The anxious patient is often children or the elderly, or can be anyone. The angry patient is usually using anger for a mask for fear. And patients of other cultures, there may be cultural differences, as we spoke about before, in eye contact, or allowing someone to touch or not touch. Language barriers can be a problem where we can, if we know someone is coming in who does not speak English well, they'll either bring someone who can speak or we can have interpreter services. Limited reading skills. If a patient has limited reading skills, we'll need to find a way to give them information that they understand. And cultural competence, again, is something we'll have to work on. Mentally or emotionally disturbed patients. Remain calm if the patient is agitated or confused, and avoid raising your voice. Do not appear impatient, and ask the patient to repeat what they're saying if you do not understand it. Terminally ill patients have extreme stress. It's often present. Hospice works with terminally ill patients, but if you come in contact with a patient who's just been diagnosed with a terminal illness, this can cause a great deal of stress for the patient. And again, they may be very emotional, so give them time and space to speak with you. Patients' families and friends can provide emotional support, or they can be a problem. So we ask the patient about preference for having others present, and we acknowledge family and friends and communicate in the same way as with the patient. If possible, we keep the family informed on the patient's status. If the patient has given approval and signed a HIPAA waiver that says, the following people may know about my circumstances. And if they say no one may know, then we need to honor that as well and not give the family any information and suggest they speak with the patient. Again, we always protect patient confidentiality. The patient with AIDS and the patient who is HIV positive, this is a social stigma, and the patient may be upset or depressed. You can ask as few questions as possible, but answer as many questions as you can, and don't act fearful of being part of the care team. Patients need to be treated with dignity. A lot of people think that HIV patients are AIDS patients. They are not. HIV positive means that you have the virus in your body. It can be in an active state or a dormant state. The AIDS patient has moved on to active disease. The HIV is no longer dormant, it is active, and it is destroying the patient's immune system, so the patient becomes very ill. So please know the difference between HIV positive dormant or HIV positive active, which can progress into an AIDS patient. Communicating with coworkers. Positive communication with coworkers is necessary. And positive, harmonious relationships or rapport are needed with their coworkers. How about communicating with management? Keep your supervisor informed. They'll let you know what they need to know about every day. Ask questions, but minimize the interruptions. And show initiative. If you see a problem and it continues, let your supervisor know. Dealing with conflict. This is a great cartoon of rock, paper, scissors. It says, can't we all just get along? Friction or conflict between coworkers is counterproductive and makes for a hostile working environment. Don't join in on negative discussions. Oh, did you hear about Jane last night? Did you know what she did? That's none of your business. And it's not the business of the work care place. And neither, if you didn't experience it, you don't get to talk about it, and you don't get to talk about negative behavior in the workplace. Be supportive and personable, and don't ask people, your coworkers, personal questions. Don't judge or stereotype others. Again, don't gossip and jump to conclusions. If you didn't see it happen, you don't know about it. Stay out of the conversation. And if negative conversations keep happening, this is a time when you go to your manager and discuss the problem. Setting boundaries in the healthcare environment is included here by making professionalism your first goal. Physical or psychological boundaries help to limit undesirable behavior. Take immediate action against inappropriate behavior, but use tact and be diplomatic. If you do hear two people gossiping about somebody in the workplace, or did you hear about this, or did you hear about that, you may just very quietly go up and say, hey guys, I don't think the patients need to hear about this, and I'm not comfortable hearing this conversation. Could you kind of not talk about it here? And if it continues, you need to report repeated inappropriate behavior to your supervisor. Always follow office policy and procedures. If you're not sure what they are, you have procedure manuals and policy manuals in place, and you can always ask your supervisor or manager what the policies are. And this ends our lecture today.